Welcome, everyone. In less than 2 weeks, millions of Americans without health care coverage will start signing up for Obamacare. Formerly, it's called the Affordable Care Act. But how affordable will the premiums actually be? The numbers are all over the map. Literally, it matters where on the map you live. We will mouse over an interactive map in a minute. First, Obamacare. As part of our ongoing series, Public Intellectual, where we look at new research that affects our lives and public policy, we welcome Avik Roy, leading Obamacare critic, a senior fellow at the conservative think tank the Manhattan Institute, and blogger at Forbes.com. He and his colleagues have put together a new map that they say will help us track how Obamacare will hit our uninsured pocketbooks. Also joining us, veteran health policy journalist Trudy Lieberman. She's a frequent contributor to the Columbia Journalism Review and teaches public health at the CUNY School of Public Health. Welcome to both of you. Thank you for coming in tonight. Set up this map for us. You've put together a map state by state comparing what premiums are going to be tomorrow compared to what they are before Obamacare, and then also with respect to what subsidies people can expect.
What's important to understand is this map is focused on people who shop for coverage on their own. So today, the vast majority of Americans either get coverage through their employer or they get it through the government through programs like Medicare and Medicaid. The people who are uninsured, of course, and the small fraction of people who shop for coverage today, that's who these exchanges are aimed towards, and that's a subset of the overall population, and that's the population that we're trying to analyze here.
So we're putting this map up on the screen. And as you can see, folks, you can click on any state to look at some of these numbers. And I want you to look, too, before we click on New York, at the 3 different categories that you can look at with respect to each state. There's state rates, how much in each state, who qualifies for what kinds of subsidies, and then some help with your decision. So let's go to New York. Let's click on the Empire State. And Avik, what are we looking at here?
So what we've done is, and as you note, the darker shaded states are the states where the data is currently available. The light colored states are where the data is not yet available because the state governments, or mainly the federal government, have not released the information yet in terms of premiums on the exchanges for the majority of the states. So we're waiting. We should get that data in a few weeks. But for New York, we do have the data, and what we see in New York is that rates will go down for the average person in New York State by 29%. And now there's a couple of caveats to understand there. The first is that that's a statewide average. There's substantial intrastate variation in New York. So New York City will have lower rates on average, and the Hudson River Valley, particularly the Albany area, will see higher rates.
Why?
Because there's differences in the insurance markets in those areas versus what they are today.
Which means people tend to be older and sicker in those upstate areas?
It can be a combination of factors. Part of it can be the hospitals in those areas and what the hospitals are charging insurers. Part of it can be the demographics, so who's uninsured, who's older, who's younger, who's healthy, who's sick. It's a combination of all those factors.
And before we get off this particular page, it is notable that the average premium would be the same no matter what age you are. You see, folks, if you look at the left-hand blocks, that's age 27, in the middle, age 40, at the upper end, age 64, just before somebody would qualify for Medicare. And you would think that insurance would become more expensive the older you get because you're in a higher risk pool, but that's not the case in New York?
So New York, since the Mario Cuomo administration, has required insurers to charge the same rates to people who are younger or older. The rates have to be exactly the same. It's called one-to-one community rating in the health wonk jargon. And what the effect of that was that because older people effectively had a subsidized rate, but for younger people it was a bad deal, younger people dropped out of the market. And so the price of individually purchased insurance in New York got increasingly expensive. And it's called the adverse selection death spiral, when young and healthy people drop out, older and sicker people stay in, and that's something that actually the Affordable Care Act will help assist with New York, because there will all of a sudden be all these subsidies, there will be the individual mandate, all these things that in theory should push younger and healthier people into the pool.
Right.
But still in New York, there will be exactly the same rates for younger and older people today as well as next year.
So what was left of the market responded to the regulation that everybody was going to pay the same rates no matter what age, by premiums going up relatively to what they had been for younger New Yorkers, because they had to help subsidize the care for the older ones. And then that got so expensive that a lot of younger New Yorkers who weren't insured in some other way just didn't get insurance.
That's the key thing. When you require insurers to offer a certain set of benefits, or you regulate the design of the insurance product in a way that favors sicker people or favors older people, which is a proxy for favoring sicker people effectively, what you're basically doing is making that health insurance product more expensive for healthy people, whether they're young or old. I think that's the important thing. We talk a lot about the age element of it, but really what the age is telling you is their risk of sickness.
Right.
So when you're young, you're just in general healthier. When you're older, you're in general sicker. But healthy people in general are subsidizing older people under that model.
Let's go
sicker people under that model.
To another state and compare it to New York, and you've chosen the state of Virginia. Or I should say the Commonwealth of Virginia.
The Commonwealth of Virginia, the Old Dominion. So Virginia is a state that actually represents much more what a typical state will see under the Affordable Care Act. As I mentioned, New York is unusual because 20 years ago under Mario Cuomo, the state enacted a lot of reforms or changes that really dramatically changed how individually purchased health insurance works in New York. Virginia has a more normal or typical insurance market for individually purchased insurance today. And what you see here is that rates go up substantially for younger individuals, 27-year-olds in this example, and 40-year-olds, but older people will see a slight decrease in their premiums on the individual market.
So Trudy Lieberman, this is such an interesting number for the 27-year-olds here. The premiums would actually, under the Affordable Care Act, become 67% higher, two-thirds higher than they are today for those younger people in their 20s. And this is where another piece of the Affordable Care Act comes in, which is the subsidies, the sliding scale subsidies to help people at different income levels who are not otherwise insured afford to buy these policies on the exchanges. Now let's see, Avik, does the map deal with that?
So what the map does, we don't yet have on the third button there contains the would answer your question most directly, and we're still assembling that data and putting it on the map. But the second button does show you the percentage of people, generally speaking, in a particular state that will qualify for subsidies. If you click on the second button, then you click on New York, you'll start to see what I'm talking about. So you'll see these pie charts, and you can scroll down, and what this is showing you is on the left set of pie charts is the percentage of uninsured people within a particular age group that will qualify for subsidies based on their income level. And the orange means that you'll qualify, the yellow means you won't qualify. And on the right side, the right set of pie charts is a percentage of the overall population that will qualify for those subsidies. And so you'll see, for example, in the 21 to 30-year-old group, 44% of the uninsured will qualify for subsidies, and 11% of the overall population of the state of New York will in that age group. But the thing to understand also, as you noted, it's a sliding scale of subsidies. So even though the subsidies in theory range within a certain income bracket, so it's 138 to 400% of the federal poverty level, actually when you get to the upper half of that bracket, the slide of the subsidy slides down to an effect that those individuals who are perhaps in the higher end of that bracket will still see a net increase in their premium.
So can you put some real numbers on this for New Yorkers, Trudy? Let's say I'm an uninsured, healthy 30-year-old making X dollars versus Y dollars. What will it actually cost me to buy health insurance?
That is going to depend on the policy that you buy.
Aha, and there's one more variable. We should be clear about this. There are several policies available on each exchange with more or less coverage.
And just to be clear about what we're measuring on this map is we looked at the 5 least expensive plans today that are available in New York and the 5 least expensive plans that will be available on the exchange, because our thought was for people who struggle to afford health insurance, identifying the least expensive options was the most important consideration.
5 least expensive plans on the exchanges. So how many different plans? And how many different levels are there going to be on the exchanges?
There's 3 different levels. There's the bronze, well, the 4 different levels.
New York is 4.
There's bronze, silver, gold, and platinum, and there's also a catastrophic set of plans which are unsubsidized. So we left them out for the purpose of the discussion. But
okay, to answer your question, Brian, what we have here is people will qualify. About 60% of the people buying this market will qualify for a subsidy, which will range from quite a lot at the low income to not very much at the people who have incomes of 400% of poverty, which is about $92,000. So that's, you know, fairly high income.
So give me your best guess as we run out of time. Avik, 1 year from now, what percentage of the U.S. population will have health insurance compared to today?
Well, if you ask the Congressional Budget Office, they would say 7 million people will be enrolled on the exchanges at the end of the first year. One point I want to make, though, is that that 90,000 figure that Trudy cited, that's for a household of 4. But the vast majority of uninsured people are young. They're under the age of 40. The household sizes are 1 or 2. And so the income levels collapse for those individuals. So the subsidies might be more like top out at $45,000 or $50,000 or $60,000 of income, which makes a big difference in terms of those young individuals and what they need to make in order to qualify for subsidies.
Prediction?
I'm not sure I can give you one.
If your prediction is right, 7 million additional people with health insurance, what percentage of the population does that still leave uninsured? Do you know it?
Yes, well, if you talk to the census, they'll say 50 million people, 51 million people are uninsured today. And of course, that's only on the exchanges. That's not counting the Medicaid expansion, which will add another 5 to 10 million, depending on which states finalize that.
The CBO estimates about 30 million will remain uninsured.
Thank you
After
both
full
very much.
implementation.
I think you brought a lot of new clarity to a lot of people about this new world we're going to enter in a couple of weeks. Thanks a lot.
Thank you.